Hi, and welcome to Couch Conversations Beyond the Textbook, where real talk meets real life in the world of mental health. We're your hosts, Abby and Bethany, two therapists who have been through the textbooks and are entering the trenches. This is a space where we unpack what they didn't teach you in grad school, the messy, the meaningful, and the moments that shape us as professionals and people. So grab a seat on the couch and let's dive in. Please note that the content of this podcast is for informational and educational purposes only. It is not intended to be a substitute for professional mental health advice, diagnosis, or treatment. Always seek the guidance of a qualified mental health provider with any questions you may have regarding your mental health or medical condition. The views and opinions expressed by hosts and guests are their own and do not necessarily reflect those of any organizations or professionals they may be affiliated with. If you are in crisis, or if you think you may have a mental health emergency, please call 911 or contact a local mental health crisis line or emergency service in your area.
Hi, everybody. Welcome back to Couch Conversations Beyond the Textbook. I'm your co-host, Abby.
And I am your co-host, Bethany. We're excited to have you guys back with us.
Yes,
We've got a fun topic today.
Yes, we're going to talk about sitting with your first clients. And I think we're talking specifically practicum first clients. First client ever.
First client ever. It is quite an experience.
It is. And I remember so very distinctly hearing our professors talk about their first clients and how they remembered it and what their experience is. And what sticks out to me still is every therapist, when they talk about their first client ever, they laugh. Everyone.
Yes. So this is kind of funny. I, for a long time since college, have worked for a private practice on the administrative side of things. And the owner of the private practice has her master's in social work. And I remember when I was going into grad school and I would just have conversations with her about, the nerves and everything that goes along with that. And she was the same way. She said when it came to sitting with her first client, she was like, I can't believe they're letting me do this. Like, they just stuck me in a room with this person and I have no idea what I'm doing. And I think that's the most common experience of any counselor or therapist that there is when you're put in a room with a client and just kind of told to go for it.
It feels a little universal. And I remember thinking when we first started grad school that there's no way my professors felt that way. They're all professional. They've been doing this for years. But every one of them would laugh and they'd say, think back on their first client. So that brings me, Bethany, to your experience with your first client.
Oh my. So actually, I've mentioned this before, but for practicum, I did all co-therapy. So
yes,
my experience with those clients was much different than my experience with my internship clients. So I can talk about both. First, for practicum, so what co-therapy is you're sitting with your supervisor in the session, and they're basically observing or watching. In my case, a lot of it was with my supervisor's clients that she already had, and so that made it a little more difficult and uncomfortable for me because I wasn't starting with most of the clients. I wasn't starting from the intake. I was starting from maybe years of time spent with this supervisor. And so I was really the oddball out in the room. And that was almost more intimidating or worse, I think, to me, to have my supervisor sitting right there and feel like they're analyzing. The reason for that is because our program required that you record every single client you have in every single session for practicum. And the private practice that accepted me for practicum said, we can't do that. We can't have every client or guarantee that every client will sign off, but we can do co-therapy. And so I took what I could get because you'll come to learn, hopefully you have a very easy going time finding a site, but that was not the case for me. And I know that's not the case for a lot of people when it comes to practicum, because of the requirements, but I was just going to take what I could get because I didn't know where else would accept me, and we were kind of getting to the grind time. all of that to say, my experience with my first client in practicum was very uncomfortable. And I would just kind of, you have to be running like 50% of the session. So once you kind of got to know the client a little bit more, my supervisor was great and she was very accommodating. And she would let me start the session, and then she would, put her input in at different times, but not super often. And a lot of the clients were super willing to do that, but I know that it put them in a weird position too to have just
Mhm.
like another person in the room, especially because they had known. There was one or two clients that I think had started from the intake with the co-therapy. So that was definitely an interesting time for me. I learned a lot from my supervisor and watching her too, and she was great, but I did feel very behind going into internship, not having had my own client
Mhm.
to sit with, and that was very stressful for me.
So tell me a little bit about what that client, sitting with your first internship client, was like.
So, sitting with my first internship client, I was very nervous. All of the thoughts of like, I have no idea what I'm doing. I only have these counseling skills that we learned. I just all of those thoughts going through my head. Like, I hope they don't think that I'm terrible, and
Mhm.
all of the things. And just having such a deep desire to help this person. I didn't know anything about them before the intake, obviously. And so just having a deep desire to help them. They were older than me, so that was already a little intimidating. It wasn't like a child that, so
Mhm.
they're just the dynamic in the room in my head felt different. I don't know about in the client's head, but I was like, why are they gonna listen to me, a 24-year-old girl at the time? And so all of those doubts were going through my head.
Yeah.
And yeah, it's just intimidating. And luckily, the intake, I think, is the easiest session because it's very direct and you're just asking a lot of questions to gain a lot of background information on the client.
Right. So, do you feel like your first session via intake via your first session non-intake was significantly different?
Yeah, I would say that the intake session, it's hard to start off counseling with that session because you're really just getting a ton of information. You're asking really uncomfortable questions for someone that you've never met. I mean, I've been through the intake session. You're asking questions that like you wouldn't normally tell someone that you just met.
Hmm.
And some clients will be more standoffish, or they won't answer, or maybe they'll lie about it and it'll come up later. We can't control that. And I also partially understand it because you're like, I've never met you. I'm actually not going to tell you about the trauma that I've been
Right.
through in the first session. But then some clients are super open about it and willing to work on their stuff and wanting to just dive right in. That was my experience with my first client, which I'm very thankful for. They were very motivated. And so that made my job easier because they came in ready. Like, they would bring a notebook in every time and they were
Yeah.
writing down notes, and they would bring their notes from the week and what they wanted to talk about. And so super motivated to, improve and meet their treatment goals
Hmm.
and things like that. And so that made that experience easier. But the difference from the intake to the second session, which is like your first real session, was very different because there is no sheet of questions that you have to
Yeah.
ask. There's no. So I think that you just kind of take off and you talk about. I mostly talk about what the client, if they had thought about what they want to work on, what they want their treatment goals to be, um, and just kind of go from there.
Yeah. I think that my experience is probably quite a bit different. My first session by myself was in practicum, and my site was very accommodating as well. And I think that I had 4 clients like set up on the first day. Um, Not that day, but like I had 4 established clients already on my schedule. So it was very, very scary. And I will never forget sitting down in my very first session and the fear that was just coursing through me and the nerves and um, the intake. And every single person at my site would tell me the intake will end up being your easiest session. And I never believed them. I was always like, there's no way I'm going to remember all this stuff. There's no way it's going to flow. It's like pages of questions. There's no way that this is going to become natural. And lo and behold, it does. But I remember sitting there and going through the paper and reading each question instead of making it conversational. And um, at the end of the session, I was like, oh, wow, that wasn't that bad. I can do that. But I had amazing supervisors who said, it's okay if you have to read it at first. It's okay if it doesn't feel natural at first. Do what you have to do to get through it. You'll be fine. They're not going to know. They have no idea how this is supposed to look. And so
Mm-hmm.
that's what I did. And yeah, that very first intake session was intimidating, but you do eventually just kind of get a flow.
Yeah, for sure. And I think that you also tend to come up with questions on your own as well. So there's some clients where you'll kind of fly through that intake sheet and all of the
Yeah,
information that you need, or they'll give you very short answers, and so that's why you're flying through it. And then you're kind of like, okay, well, you're looking at the clock like we still have, 25 minutes left. What are we going to talk about here this first session? Because you obviously don't want to get into something crazy and then be like, sorry, we don't have time to unpack that.
right.
So there were questions that at least I would start to come up with questions that weren't on the intake sheet that I felt like were important. Part of that is probably some of my theoretical orientation coming through and thinking that there should be more questions about the client in different areas of their life. Um, did you feel like you had that same experience?
Yes. So I noticed that we were told that some clients will take 2 sessions to get through the intake, and some clients will take 20 minutes. And I definitely had felt more on the 20-minute side than I did on the 2 days or two
Mm-hmm.
sessions. Um, and I found that to be, for me, a really valuable time to start building a rapport with my clients and just getting to know them. It was kind of every time felt a little bit like a first date. Like, do you have pets?
Mm-hmm.
What do you like to do for fun? What are you involved in? Um, Tell me a little bit more about your family. Just a little bits of getting to know each other. And I always ended my first session with, what kinds of questions do you have for me? I will answer appropriately whatever I can answer for you. Um,
Mm-hmm.
and it always was, I found that to be an incredibly valuable session as far as getting to know each other and giving them
Mm-hmm.
a little bit of autonomy in the session to be like, oh, I'm allowed to ask you questions? Because I got that a lot. Oh, I'm allowed to ask you questions about your life? And so, yeah.
Yeah, that's such a good point of letting the client also ask you questions about your life. That's not really
Hmm.
something that I have put into practice. I'll sometimes recently have asked, do you have any questions for me? But when
Hmm.
I first started, I definitely did not do that because self-disclosure was a fear for me. And so I was like, I don't know
Yeah.
what's appropriate here. And I don't really want to have to put myself in a position where I'm navigating that right now. But
Hmm.
I think that that's a strength of yours is being willing, but also still having boundaries with it and not being afraid to
Right.
say, I'll answer questions that are appropriate, but I'll let you know what's not.
Hmm. Yeah. Um, I have found that sitting with those first clients, it did for me, it took a lot of pressure off just looking at it as communicating. And we're just
Mm-hmm.
communicating. It's not me trying to fix my client because that's not what we're here for.
Mm.
And I noticed that with a lot of my clients, I mean, I work with college-aged clients, and a lot of them had communication problems. They were brought up in households with um, a lack of communication at times, and just teaching them how to communicate back and forth and giving them the autonomy of the session and saying things just straight with them and direct and saying, they want to know, do I have a family? Yeah, I'll tell you whether or not I have a family, but I'm not going to go into detail about my family.
Right.
And just having a very direct conversation with them.
Yeah, especially that can help build rapport because we're asking them about their family, or at least those are
Right.
questions that I started to add when we had extra time for
Hmm.
the intake is tell me about your
Yep.
family. Do you have siblings? When were like what order were you born in? Are you a firstborn? Are you the youngest child? Because I find that
Yeah,
interesting, me and my Adlerian brain.
there's
And
a lot to
so
be said for that.
yes, and I think that those things are important
Hmm.
obviously. And so those are things that I would start to ask. But when we're asking, clients those kind of questions, we also can expect that they're wondering the same about us,
Right.
not that we're going to go into the same amount of detail. And most clients I have
Hmm.
found are very receptive of that. I haven't had a client that's asked me anything inappropriate or anything like that
Right.
they're wanting so much detail in my own life. Most clients really want to talk about themselves. They don't really want to hear
Yeah.
that much about
That's
you. They
what.
want to know enough about you to be like, okay, they're a human being,
Hmm.
but they want to talk about themselves. That's why they're there, and that's okay.
Right. That's what we prefer.
Yes, for sure.
So sitting with that first client, and we say first client, I'm meaning more like your first few. Um, Tell me how your process changed throughout the first, say, 8 sessions.
Um, that's a good question. I think that like my process changed with the same client, you mean?
Yes. Yeah.
I think that as you get to know a client and as you build rapport, you your conversation just flows more naturally. You know them more, you start to pick up on things. When you've built rapport, I mean, by the eighth session, hopefully you're in a place where you feel like you can challenge their thought process,
Mhm.
that you can get to more of the nitty gritty, if you will, of things with them, more into the working stage of counseling. And I think that that is a great place to be with a client because it just feels more natural. It starts to come more naturally with them. And that's kind of when things like silence or things like that start to feel more comfortable because you pick up on their cues more.
Yeah. Yeah, I would agree with that. I also, for me, I think the I you start off, or for me, I started off being very much trying to hit all my counseling skills. Did I hit immediacy? Did I reflect the
Mm-hmm.
feeling? Did I reflect the meaning of this? And trying to check them off the first, well, quite a few sessions. You're trying to check them off. And it wasn't until I had been in practicum for a little while and talking to my supervisor about, she asks all the great questions of, well, how was that for you? And where were you in the session? And like you said, in our program, we had to record every single session and not just voice record. We had to visually record every single
Mm-hmm.
session. And so we're going back and looking at those, and our supervisor's watching them, and we're sharing them with our class. And I will never forget because with our program, we weren't allowed to ask questions in
Mm-hmm.
practicum. It was very strict. You do not ask questions. And I remember going to my supervisor saying, I'm really struggling with this. I'm asking way too many questions. And her saying to me, that doesn't matter.
Mm-hmm.
Ask questions. I know it matters for your program, but stop stressing yourself because you're in your head about it. You're so
Right.
stressed about not asking questions that you're asking them. And
Yes.
when you start becoming a therapist in your life, that doesn't matter anymore. And just taking that pressure off of, oh, I don't have to check these things off really while I'm in here because it was so, and rightfully so, they really emphasize these are your skills that you need to be working on.
Yeah.
But once you're sitting in that room and you get a little more comfortable, it's natural. They become part of just like any other training you do.
Yeah, during practicum for sure, when you only really have your counseling skills that you've learned and that you've practiced and during that
Hmm.
class counseling skills when you can't ask questions and they emphasize that. I understand why, but it does make it hard when cuz then you're in your head during a session
Yeah.
and during practicum you really only have those skills that you're trying to portray for your professor to say you're doing a
Yes.
good job. And that is intimidating and it makes you so in your head. I'm actually laughing because I still have this sticky note with all of the, the counseling skills written down.
Oh, that's
So
hilarious.
for those listening, just audio, the counseling skills, I'll go through them, are paraphrasing, summarizing, keywords, clarifying, restating, reflection of feeling, content, and body language, encouragers, empathy statements, silence, and immediacy. And I still have the sticky note from counseling skills. I used to hang it on my laptop as we were recording.
I love that. I love that you still have that
It's
because they
fun
are
to look
important.
back on. They are, yeah, they are really the basis of
The foundation.
counseling.
Yeah.
Yeah. Yeah, but those things, like you said, are going through your head. Oh my word, am I paraphrasing too much? Am I just,
Hmm.
the keywords is always funny because you're just kind of restating a keyword as they're talking that you think is important.
Important.
Yeah, exactly. The
Important. Yeah.
immediacy I learned to love.
Yes.
Um, you'll start to, I guess, I don't, challenging isn't really on there, but you learn how to challenge
That one's my favorite.
during that class. I could see that being your favorite.
I love that one.
How long do you think that it took you to get comfortable to challenge clients that you were sitting with or your
It
first
took me a
client?
long time. It took me a long time. I'm a pretty direct person in general, but I was scared of being overly direct because I am just the person who you want an accountability partner. I'm there. I'll be there with you.
Mm-hmm.
Um, but that's not my job as a counselor. And I mean, I guess to an extent it is, but um, it took me a long time to be able to do it appropriately. I was scared. But I do remember the first client that I did challenge and how excited I was because it worked
Mm-hmm.
and it was received well. But it takes a lot of, uh, you have to have a very strong rapport with your client to be able to appropriately challenge.
Yes, and understand what kind of challenging your client needs,
Yeah.
which takes a
Yeah.
strong rapport because you might
Hmm.
just have to challenge with some humor or sarcasm
Yeah.
in a way, or just very direct. Some clients just need someone to directly say whatever it might be, like, and challenge them in that way, or challenge them to think differently, like, oh, I wonder what that person's point of view, what you think that
Well,
person's point of view might be, something like that.
how's that been working out for you?
Yeah. That's always a good one. With my clients now, we can kind of laugh about it. Once you build rapport, you can
Hmm.
be like, "Oh, I'm not sure why you thought that would go well for you, but
I digress. I digress. Um, but yes, back to those counseling skills. They are foundational. But I even notice now, after having, being through practicum and internship, that I catch myself just talking conversationally with people in my life using counseling skills.
mm-hmm.
It just becomes so ingrained and part of the way you conversate.
Yeah,
I catch us doing it in this. Tell me more about that. Like I catch
yeah,
you and I doing it to each other, and it makes me laugh, but it's just part of how you conversate eventually.
yeah." It's funny because I remember my first few videos in practicum. Also, my practicum professor was the head of our program, so there was already that was so intimidating to me. I was like, "Oh, she has the power to kick me out of this program," which technically any of the professors would, but it was more intimidating. But she's so sweet. So practicum was great, but I remember her saying, "You start your sentences with the same thing quite often." I think I would say, "I'm wondering," or "I'm curious," and that's
Yeah.
all that I would say to start a sentence in practicum. And then you start to think about it during sessions, like when your professor tells you that you're doing that, then you start to think about it and you're like, "Oh man, I really am saying this." Even now, there's those key phrases that you kind of cling to when you're making conversation or
Hmm.
trying to reword a question to be open-ended versus close-ended. And yeah.
That is so true. And those are the things that we did to keep ourselves from asking questions.
Mm-hmm.
And back in practicum, that's what we relied on was, okay, they said that I can say, I'm curious and I'm wondering, and tell me. Those three ways will keep me from asking a direct yes or no question. And that becomes your lifeline to not ask those questions, but then it becomes repetitive and then it becomes almost a hindrance. And so you have to really think about the balance and I don't know, tell me how you would get out of your head. What were some things that you did at the beginning of practicum that helped you calm down in the session?
I think reminding myself that the client doesn't really know any better. So they're not taking that pressure off myself. If the client isn't
Hmm.
going to be like, ooh, gotcha.
Yeah.
Like, you're not
Yeah.
doing this because they don't know any better. And
Right.
at the end of the day, what our clients need from us is someone who's going to listen to them and empathize with them. And
Uh,
I can do that. And of course, there's so
right.
much more to the counseling profession and being a therapist. But at the baseline, that's what our clients need and that's what they're looking for and what that they want. So if you can do that
Right.
and maintain empathy for a client, you will be okay.
Absolutely. When you are sitting in that chair for the first few sessions and you feel like you've been in your head the entire time, if you can sit there and say, I was empathetic and I listened, then you are successful because
Mhm.
everything else is going to come. And if you have more than two sessions generally, 2 or 3 sessions to be able to get out of your head. And so
Mhm.
as long as you can sit there and say, I did this and I did this right, then everything else is going to come. We all make mistakes. And like you said, the client has no idea.
Yeah, they really do not. And there's a beauty in that because you have some space for not failure, but to learn.
Error.
Yeah, you're learning with the client, which is really fun, but it's definitely intimidating.
Yes. I had clients who would, I mean, they have to sign a consent to be seen by a student. So they all know that we're learning. And I would have clients say, is there anything else I need to do to help you with your classes? Is this good? Like, should we talk about this or this? And I just loved it because they wanted to see success in us as much as we wanted to see success in them.
Mm-hmm.
And they loved that. What they were there for was helping us too.
Yes, that is one thing with even my internship clients. I I never told a client, "Hey, you're my first client, you're my second client." But of course, they do have
No.
to sign the informed consent knowing that
Hmm.
they're working with a student, a grad student, and that we're under the supervision of a licensed professional, all of that fun stuff. But they knew that I was a student, and I remember having the conversation of like, "Hey, I'm graduating soon," and some of my clients that I started with, I was, finishing up with when I was graduating. And I just remember them being so excited. They're like, "How are you feeling about graduating?" And they know that they were a part of that journey with me. And I think that there's something really cool about that too. Even though, of course, I didn't, go into detail about my program and my learning and how they were basically teaching me. They were
Yeah.
teaching me as I went.
Yeah.
And it was cool though to get to reflect with them of just being like, I am really excited and we're moving on to a
Uh,
different stage in life and all of those fun things. And so getting to have the same clients throughout internship was cool.
yeah. Yeah. And those first clients we sit with sometimes will be the last clients we sit with also.
Mhm.
And to be able to reflect on their growth and our growth. And that was something that I was able to do because I had the same site for both practicum and internship. I had a couple clients that I had from day one to my last day. And when we went to terminate our sessions, which is something we'll have to talk about eventually, but we were able to reflect on their growth. And mm, all of them asked me about my growth in my program. And it was so fun
Mhm.
to have that reflection together, and to say, hey, we got this together. And it was incredible.
Yeah, getting to see clients' growth or reflect on it is one of the most satisfying parts of our job. It
Yeah. Oh,
really is
100%.
what keeps you going because you can look back and getting to encourage clients and say, I know you might be still struggling with some of these things, but let's talk about all of these things that you've accomplished and done since you started here. And
Absolutely.
not that any of that is on us. Like, I'm not saying I want to take ownership of my clients' successes, but it's so cool to be someone that got to walk alongside them
Right.
as you watch their success or them meeting treatment goals or things like that.
The journey. the journey together. Um, that part was always super beautiful and really my favorite part. I also really enjoyed those clients that I had from beginning to end, asking them, "Well, how did you experience this? How
Mm,
was your experience?" And that is something that's very valuable with clients that you have from the beginning. And when you get to that termination and you learn so much from them, because it's totally okay to say, "How did you experience our session today?" Or "How did you experience the last 3 months that we've been seeing each other?"
mm-hmm.
And learning from them in that way too. That's absolutely appropriate.
Yeah. What would you say you do differently now with clients than what you did with your first client?
I'm out of my head now. I mean,
Mm,
there's always moments of,
mm-hmm.
"Oh, I probably should not have said that way." But I'm much more comfortable in the seat where if I do that, I can say it to the client and be like, "Yeah, I probably should have said that a little bit differently." Um, with most of my clients, I have a good enough rapport where I feel like when I mess up, I can say, I should have worded that differently. Or,
Mm-hmm.
"Do you understand what I'm trying to say?" Because I have a tendency I'm not always very articulate. And so
Mm-hmm.
when I'm trying to get a point across, to ask them, "Do you understand what I'm saying here? Are you making the same connections I'm making?" And work through it together. Whereas when I first started, I would be so in my head about that, not saying something the right way, that it
Mm-hmm.
would throw off the entire session. And instead of letting it throw off the session, now I can use it in session and say, "Let's connect on this because I'm not sure I'm articulating myself well."
Yeah, I'm laughing because I'm the same exact way, and people can probably tell when they listen to this podcast that I tend to ramble because I over explain myself. And I
Hmm.
remember my practicum professor, and she'd be like, just stop. Like, say that and then stop. You don't have to over explain. But it
Hmm.
felt like I think a lot of times I would ask, does that make sense? And it wasn't in a
Hmm.
derogatory way, but mostly because what I wanted to say in my head, I wanted to make sure it was transferring to what was coming out of my mouth to
Right.
the client.
Right.
And so then I would ask like a really great, counseling skill prompt or whatever to get the client to talk. And then I would continue by following it up with saying it three different ways.
Yeah.
And
Yeah.
it wasn't necessary, but I was overthinking. And I still tend to do that because I do
Yeah.
want to make sure that clients understand. And there have been times, and this is funny, but this will happen where a client is like, I don't really understand what you're asking.
Yeah. And I appreciate that because then I'm like, okay, let me rewind and reword what I'm saying,
Right.
rephrase what I'm trying to say. Um, do you find yourself being able to have those conversations now with clients where you're like tripping over your words and you're like, okay, it's not coming out clearly?
Yes. So at first, the first time that a client probably told me, I don't really understand what you're asking or what
Hmm.
you're trying to say, I'm sure that I felt super embarrassed and was like, oh my gosh, I'm so dumb. I need to pull it together. But now I think I'm just like, okay, let me say that differently or let me
Hmm.
think about what I'm trying to say. Sometimes I'll even say that before and I'll just say, I'm trying to figure out how to say this
Yeah.
because I that lets the client know that you're human too. We don't always know
Hmm.
exactly what to say. And sometimes a client will say something and I do need a minute to process how I'm going to
Yeah.
respond. Maybe
Oh,
not a full
absolutely.
minute, but
You
some
just need
time.
a little bit of silence to be
Yes, a
able
little
to
bit of
get through that,
silence. Yeah, and so
utilizing
sometimes
that skill.
yes, and so sometimes I'll
Hmm.
say I'm trying to figure out how to word this the
Yeah.
best way. But no, clients will let you know like when they don't understand something or when you're wrong, when you let's say like with reflection of feeling, that's
Hmm.
when you're like, so it it seems like you're feeling this way or something like that or like I'm
Yeah.
getting the sense that you're feeling frustrated or something.
Yeah.
And then a client will correct you if you're wrong. And they might be like,
Yeah.
"No, I'm not feeling frustrated. I'm actually really hurt by this." And you're like, "Oh, well tell me about that." So, That is scary when you're first starting though, because you already feel
Yeah.
like you don't know what you're doing. So when a
Yeah.
client corrects you, you're just like, "Oh man, I really messed that up." But there's something to be said about a client that's comfortable enough to tell you when you're wrong.
Absolutely. And you want them to because you don't want to take this entire session down the wrong path. Um, but you can't, just like they can't tell what we're thinking, we can't tell what they're thinking unless they tell us. And
Yeah.
so I think that that's also part of why it was always, and it's always been so important to me to have such an open line of communication. And I do tend to over communicate sometimes, because I want to make sure that we are on the same page. And to do that, you ask questions, whether you're asking direct questions or indirect questions. Um, but I think ultimately, when you're in those first few sessions and you feel completely thrown off your game, it's okay. Because again, it falls back on, are you listening and are you having empathy for your client?
Right. And like I said, if a client feels comfortable enough to correct you, that means you're doing a good job building rapport
Yes.
and that they trust your relationship enough to know that they can say, that's actually not how I
Hmm.
experienced that. And you can say, oh, well, tell me more about that. Like, how did you experience it? And I think that, well, there's something great about that because it's learning for you and the client, where let's say you reflected a feeling that they weren't feeling, well, then
Hmm.
they have to think about how they're actually feeling to be able to correct you. And so
Right.
they're digging deeper into their emotional awareness in order to tell you how they feel about a situation.
Yeah. Progress is being made no matter what.
Yeah. So allowing even what might feel like, the wrong thing or a
Hmm.
failure on the counselor's side of things, allowing yourself to remember that that's also a learning experience for them. Like they're growing
Yeah.
regardless. And you're also
Yeah.
learning. And it's okay to
And
be
that,
wrong.
oh, absolutely. Absolutely, it's okay to be wrong. I almost sometimes prefer to be wrong because you get more information when you're wrong.
Mm-hmm.
Not to say that you should purposely try to say that they're feeling the wrong thing, but if you do get it wrong, you will dig a little deeper. Another really tricky part about sitting with your first client is your timing and making sure that you're ending your sessions at an appropriate time. You're not ending too soon. And something that I noticed when I first started was the lull when especially those first few sessions where you're having a hard time getting your timing down and stretching out a session so it doesn't end too soon.
Mm-hmm.
What were some things that you would do in a situation where you notice that you're hitting a lull and you still have 15, 20 minutes left in your session, but you feel like you've kind of run out of things to talk about?
That is a good question. I sometimes, it depends on how well I know the client as well.
Okay.
If they have multiple different things that they're wanting to work on and we spent the majority of the time on one thing, I'll just start
Hmm.
talking about another thing that they were wanting to work on. Or if I know, hey, last session, this might not be on their treatment goal, but last session they told me about a fight they had with their husband, maybe I'll just check in and see how things are going with
Okay.
that, or if they need things like that. So trying to
Uh-huh.
make sure that you can recall things that you've talked about before, which is why case notes are important. Read them before you go into the session with a client because you
Yes.
will forget. And trying to just remember things that they're interested in too so that you can bring those things up. And honestly, it's the client's session, so leaving it up to them, you could even say, "Hey, we have about 15 minutes left. Is there anything that's super important for you to discuss
Yeah.
during our last few minutes of the session?" And then you've set the boundary of we have 15 minutes left, especially if they're a talker.
Yeah.
And you've also given it up to them where you're not directing the session. They know, oh, there
Uh-huh.
actually is something. And some clients will save the big things for the end because they're
Oh,
hard. And
yeah.
you've now given them space to do that.
Yeah. Without waiting to the last 5 minutes and opening up a box. At this
Mm-hmm.
point, if it's 10, 15 minutes, you can say, let's touch on it, but I don't want to dive in too deep. So
Yeah.
let's talk a little bit about it and then we can start their next session.
Mm-hmm.
Um, Something else that I noticed, and I love what you said about giving them the autonomy of the session and saying, is there anything else going on? And the case notes are huge. read your notes, because
Mm-hmm.
if you read your notes right before the session, it's fresh, and you can, because you will 100% forget or
Mm-hmm.
mix up different sessions with each other. And something that was my professor taught me in my counseling skills is to always have, and this is something we'll get into later, but always have assessments and interventions at the ready. Something
Mm-hmm.
that you're comfortable with, where if you are at the end of the session and they say they don't have anything, you don't have anything. Okay, well, let's grab this. We did the GAD-7 anxiety assessment at the beginning. Why don't we just run through that real quick and see where you're at?
Mm-hmm.
Or I have this exercise that can help us kind of work with this issue that's going on. I have this, um, trying to think of something that works with communication, or something like that. Let's work on this communication or this distortion worksheet together for these last 10 minutes, and always
Yeah.
having something prepared.
Yeah, and putting in the work too, it doesn't take very long. There's sites that you can find interventions and
Yeah,
things for worksheets. And I'm not a huge worksheet person in session, and it
I'm
depends on
not
the
either.
age group. But
Hmm.
I will say, even having different things ready that
Yeah,
if you know a client is coming in and going to talk the whole time, don't worry about it so much. But if you know that a client is coming in and there's typically 10 or 15 minutes or even 20, 30 minutes that you're going to hit a lull, then have something prepared that
right.
is similar to what you're talking about or their treatment goals. So maybe like communication or I don't know, something on depression, psychoeducation, a breathing technique, whatever it might be that
A
you
quick
can.
game.
Yeah. Yeah. So I'm curious because we talked about, if there's a lot of time left at the session, but how do you handle if a client's a big talker and you're looking down and it's, 52 minutes and you haven't talked about scheduling yet? What are you doing?
Oh, I have found myself in that situation more times than I would like to count. And it is tough because I don't like to interrupt.
Mm-hmm.
And I have a very hard time ending a session, especially if they're just really in it and you're already 3 minutes over.
Mm-hmm.
Or, because generally I think we had about 10, 15 minutes between sessions. And so something that I had to start teaching myself is, when there is a pause and you're coming up on that 10 minute, and even if they're really in it, be like, I know that this is really weighing on you and we are in a really good spot in our session. I just have to let you know we have 10 minutes.
Mm-hmm.
So, and because they will pause for you to interject. And so to utilize that time wisely. And if you are at that last few minutes and they're still just going, you'll have to interrupt. And there have
Yeah.
been sessions where I've had to literally stand up and walk to my door while they're talking
Mm-hmm.
and give them okay, it's time to go. And that's hard and it's uncomfortable, but I have never once had a client get mad at me for it,
Yeah.
because they don't
Something that,
realize.
sorry, I didn't mean to cut you off.
No, you're good. That's all I was gonna say. They don't realize that they've gotten to that point yet. So if you have to stand up and walk to your door and even start opening it, or say, "Hey, our time's up," as you're opening the door, that's what you have to do.
Yeah. Something that I have done is, at least where I work now, I will stand up and grab my laptop because I always talk about scheduling. So clients know when I'm talking about scheduling for future sessions, we're done with the session. Like we're not getting
Mm-mm.
into new topics. And so even having those, little cues or boundaries within the session with your client will teach them as well. And
Yeah.
yeah, just making sure you have something. Sometimes, like you said, if they're really, discussing a topic, once it seemingly hits a good stopping point or I get a feel for what they're talking about, where we could stop, I'll
Hmm.
interrupt them and say, we're out of time for this week, but I would love to pick up here next week or next time I
Yeah.
see you.
Yeah.
And I think this is a really good place to stop. I don't want to get too much deeper because we're out of time for the day. Just
Uh-huh.
finding little like sayings that feel right for
Yeah.
you to end a session. But that's really hard when you first start because you don't
Yeah.
want a client to feel like you don't care because that's not the case. But how we run sessions and set boundaries in sessions also
Hmm.
is teaching for the client of
Yeah,
how that works.
absolutely. And I remember the first time I heard an experienced therapist say that they had to basically stand up and do what I've had to do in the past, thinking, that's so rude.
Mm-hmm.
And then when I got into a situation where I had to do it, I was like, okay, I get it. Like sometimes that's the only way because this is their safe space and they have the autonomy of the session, but you have the boundaries.
Right. For sure. Being in your first session is just a whole new world as a little baby counselor in training. But it's all very exciting and scary, and you learn so much from sitting with clients, more than you could ever learn from the textbook.
Yeah. So if you could say one thing to somebody who's getting ready to start their practicum in the fall about sitting with their first client, what would you say to ease their nervousness?
We've said this quite a few times, but first, take the pressure off yourself because the client doesn't know any better.
Yeah.
And kind of what I said at the beginning of, if you are listening and you care about the client and you give them a space to talk about what they want to talk about,
Uh-huh.
and are just someone that's there for them and providing a space of
Hmm.
empathy, you're going to be okay.
Right.
And everything else will come.
Yep.
And you'll also never stop learning. So you're not ever going to be perfect. And that's okay too.
Yeah.
What about
That's
you?
great. Mine would be similar. I think I would also say you can't mess this up.
Mm-hmm. Yeah, you
You
can't mess
cannot
the
say
client up more than.
no. They're there because of what they're going through. They are not even thinking about what you have to do and what you're sitting like. You can't mess that up.
Mm-hmm.
You cannot
For
mess
sure.
sitting. You cannot mess up listening. So,
You cannot mess up listening. I like that. Well,
yeah,
that is a good place to end our podcast for
I
the
love
day.
it.
So thank
Yeah,
you everyone for tuning in and listening. Please like, share, and subscribe to our podcast if you know
yeah,
anyone that might be interested in these topics or just want to feel less alone in grad school or outside of grad
yeah,
school. We're trying to normalize the therapeutic experience here. So
yeah,
feel free to share it with anyone that you know. But thanks for
yeah.
listening.
And I would love to know if anyone would like us to go live during a podcast at some point. I think that would be something that would be kind of fun if anybody would tune in.
Yeah, so if you're wanting that, leave a comment and
Q&A.
yeah, leave a comment or yeah, any questions that you want answered, anything like that, we're happy to do it. So, we'll
Yep.
see you next time.
See ya. Thank you.
Thanks for hanging out with us on Couch Conversations Beyond the Textbook. If today's episode resonated with you, be sure to subscribe, leave a review, and share it with someone you think can relate. Keep showing up, keep learning, and remember, the best growth doesn't always come from a textbook. See you next time.